So the Competition Commission are recommending more oversight and the introduction of a health regulator which will formulate a new approach to licensing hospitals. Well, Public Interest Law Centre Section 27 has been involved in the health market inquiry and public hearings. Those were in 2016. Along with the Treatment Action Campaign, it's welcomed the release of the report today. To discuss, we're joined by Executive Director at Section 27, Umunyana Rujeje. Thank you for being with us, Umunyana. Does this confirm what many patients, their gut feel, that they're being ripped off, basically?
I think it's quite clear that a lot of work has happened over the last 5 years, and there has been work that happened between the interim report and the final report.
So the interim report last year?
Last year. And I think it's quite clear there's a confirmation that in South Africa we pay too much for healthcare services. And in particular in the private sector, what has been confirmed is that some of those driving factors are overutilization. So the Commission has looked at what the incentives are that are driving competition or not driving competition. Because what we know, basic principles, is that more competition will reduce prices so that the stakeholders are actually competing on value for money, on quality of services, and on outcomes.
Let's look at that lack of competition. So the hospital groups, Netcare, Life and Mediclinic, I think they're heading towards sort of 90% of admissions. That's huge. But they've said, basic economics would say there's some scale for them, economies of scale, so maybe they can bring down supplies of beds. That should be passed on to consumers. There are also 3 of them, so there should be some competition for patients. Why has it failed? Why hasn't it worked?
So what the Competition Commission found is that there are extremely high levels of concentration within the facility sector, which is the big hospitals. And what they said actually is that some of those facilities are driving utilization, and that there are massive profits in the sector, the hospital sector. And I think what the Commission is saying is that we've got to do business differently. This is a market that involves access to healthcare services, which are a fundamental right in terms of our Constitution. And that means we're going to have to do business differently. It means that there may not be such huge profits in the hospital sector, but they also looked at the kinds of incentives around the funder side, and in particular around the administrators. And the administrators are also highly concentrated, and that's the part of the medical scheme sector that is profit making. So the non-profit side of the medical schemes is a much smaller sector, and there's a lot of money that just gets taken out that doesn't go back to consumers where there are savings made, and that simply goes into profits. And what the report has said is that one of the perverse incentives is that the administrators are accountable to their shareholders, and shareholders always want to maximize profits. And this whole system was set up as a system of solidarity, and at the end of the day we've seen huge profit making and less access.
So we're now talking about medical aids as well. There's a concentration there. Discovery, Med Scheme, MMI. Again, they've said, but we can bring down the hospitals, we can bring down prices for patients with our clout. But that's not happening.
That's not happening. And one of the recommendations is around the governance of those medical schemes. So the trustees are essentially there to protect the beneficiaries, who are the patients. And they're supposed to be taking steps like using their bargaining power to reduce prices, to gain scale. And those costs should not be going up. They should actually be making savings, and those savings should then go to the consumers or the patients.
But we're seeing rising prices.
But we're seeing rising prices there as well.
What about the recommendations? So it seems like the Competition Commission not talking about breaking up hospital groups or medical aid groups. Are you disappointed with that, or will a new approach to licensing, as they've suggested, work?
Look, we were not really that concerned about divestiture. I know that the private sector stakeholders had very strong views about that. I think our concern is that we want to maximize access to healthcare services. And if the Commission feels that there are other ways in which to achieve that other than divestiture, which is just one form of a remedy, then we would like to see the engagement of the state with its own regulators within the system. So, for example, the Council for Medical schemes being strengthened so that it can properly regulate the medical schemes sector. There's another recommendation around a supply-side regulator, and the purpose of that would be to look at pricing, which is an important part of accessing healthcare services, to actually start to set prices. And what they've recommended is that there would be at least one benefit option that is common amongst all schemes, and that the tariffs for that benefit option would be compulsory. And then there can be more competition around providing better value, providing better services, as opposed to just competing on how to get younger members into a medical scheme.
Well, the Competition Commission has talked about the obtuseness of the options. People don't know what they're buying. So you're talking about something more transparent, where each one says, here's the price for that basket of goods. So you're comparing apples with apples. Is that correct?
Absolutely. And I think for anybody, it's almost impossible to compare schemes because the options are so varied, the information so limited. And one of the early findings of the Commission was the information asymmetry, which means that patients, beneficiaries, as well as doctors don't have enough information to be able to choose what they can afford in terms of a scheme, a benefit option, and actual services. And importantly, the supply side regulator will also look at quality. And I think that we often get the sense that, oh, the quality must be fine. But what we don't have is real information and data around the outcomes of health interventions. And that's one of the reasons why overutilization has become a problem. And the remedy that has been proposed is that a regulator would then begin to look at quality and provide publicly available information to doctors and patients.
So we'll see what government actually implements. Just going back to the start, there was some opposition to this, and I'd like to know why you supported it. The opposition basis would be that we've got public hospitals that serve the majority of South Africans. They really need to be helped. Why are we focusing on the private healthcare system? And I know it's not as simple as this, which isn't taking taxpayers' money. It actually is. But you can take that away and say, that's for people who can pay. And if they want to pay, why do we need to, put our hands there when the public sector is so troubled?
That's a good question, and I think that the answer is in the Constitution. And the Constitution has a vision of equality, substantive equality, which means that whilst we've come from a system of a divided health system, which served black and white people separately, we must look at a sector, begin to see a sector that is more equal and that has more access to quality healthcare services. Now, the focus on the private sector has been a single health market inquiry. In the public sector, there are many interventions. There's regulation, there's training of doctors, human resources for health. There's a whole lot of interventions happening on the public healthcare side. And that's not to say that we should turn a blind eye to the high cost of services in the private sector. And it's not just about, rich people. I think that's also important. It's working people. It's people who get medical aid through their companies, and they may be able to afford a small package, but that package must add value. It must be value for money. And that is also about access to healthcare services, which is a fundamental right in terms of the Constitution.
And this inquiry now in the context of us as South Africa moving towards a national health insurance, does that make it ever more important?
I think it makes it ever more important. And in fact, the Deputy Minister of Health today said that this is the most opportune moment for this report to come out because it will add extremely high value to the debate around NHI. NHI essentially creates a single payer, which is the state. And I think what is important is that what is envisaged by NHI is that the fund will purchase services within the private sector. Now, we must get more efficiencies in the private sector. We must address the weaknesses within the private sector. We must shore up the regulators as well, because that's an important part of delivery of healthcare services.
All right, well, thank you for that explanation. So this 250-page report, it's not a small report, but that will be looked at now by the Health Department, by Parliament as well, those very comprehensive recommendations from the Competition Competition Commission. And that was Executive Director at Section 27, Umunyana Rujeje. Now,